Welcome to Forward Ever, Leading in Challenging Times, presented by Worth Wealth Management, a weekly conversation with area leaders about how to persevere during uncertain times. Now here's your host, Gary Shorman.
Good morning and welcome to our show. We have a special guest that represents really people across the entire country who not only struggle with cancer, but are finding a way to live with cancer. Our guest is American Cancer Society Chief Patient Officer, Dr. Arif Kamal. And Doc, good to have you on board with us today.
I appreciate me being here.
You know what, as a background, just a little bit, you're not only with the American Cancer Society, but you're at Duke University, where you've been there for 12 years. You served as an oncologist, a researcher, and it says an innovative leader at Duke. Mm-hmm. And being a part of the Duke Cancer Institute, obviously playing a role with the American Cancer Society fits right in. One of those things you do is you work with a Crucial Catch program. That's the NFL's program to help catch cancer early. Talk a little bit about that program and what it means to people.
Yeah, we're pretty proud of this partnership with the NFL, which now has turned a decade old, and we look forward to more decades to come. This was really a partnership with a genesis from understanding that the best way to really cure cancer is to find it early. And, what we know, for example, in breast cancer is that if we find it at stage 1, the cure rates are 95% and higher. But if we find it at stage 3, that cure rate goes down to about 40%, pretty big drop. Now, how does something go from stage 1 to stage 2? It's because it got time to grow. And the idea with cancer screening is you find it at stage 1 before it has time to grow, and then you cut it out and maybe give a little radiation. The other important part is that when we find it early, we can oftentimes avoid what people think about as somewhat being scary associated with cancer treatment. That's like chemotherapy, losing your hair. When we find breast cancer as an example at stage 1, most women don't require chemotherapy at all. We cut it out and they go on their very way and have, a 95% chance they'll never have to think about it again. And so our partnership with the NFL is to bring attention to cancer screening through the Crucial Catch program, not only about the idea of who should be screened, but also a reminder, because what we saw during COVID is that we asked people to stay away from health systems for their own health. And what we saw is that there were about 6 million women, for example, that missed a recommended cancer screen. And we want those folks to return back to get those things scheduled and to, put it front of mind, because we don't want to lose the progress we've made in several different cancers where screening has reduced the number of people dying because we found it more early.
One of the things you notice if you watch an NFL game, the Chiefs had it a week ago, Monday night. They had their Crucial Catch event where they had things going on. That was a neat program, neat to see. You see it on individuals that say, the coaches on the sideline says intercept cancer, some really creative, colorful gear that goes along with that. Breast cancer is one of those, but there's a whole series of cancers that if you catch it early, it can make a difference, right?
That's absolutely right. So, prostate cancer is a good example of that. Lung cancer is a good example of that. But what we see is that, less than 50% of men have gotten routine prostate cancer screening. What we see is less than 20% of people eligible for lung cancer screening have actually gotten that screening as well. And for colonoscopy, that's about 60% of all people who are recommended have received it as well. And so what we know is that the major reduction in cancer mortality, meaning the number of people dying from cancer, has gone down by about 25% over the last 20 years. Now, why is that? It's because more people are getting cancer screening across several different types of cancers. What I'll also say is there's some new and exciting things coming down the pike where, in review now and under big studies, though not ready for prime time, are blood tests that may actually look for early signs of cancer across multiple, like dozens of cancer at one time. Now, there needs to be more evidence around that, but it really highlights all the different innovations that are happening. But importantly, the best screening test is the one that gets done, right? It's not that it's available, it's that it gets done. And what we did particularly this year with the NFL is partner around helping people find where the testing centers are so they can get done. So if, for example, if someone texts catch to 365 that they will find a link, and in that link they can put in their zip code, and in that zip code it will show them all the different cancer screening centers that are in like 20 miles of where they are. And so this is really kind of a way where we in the NFL are working together to help people problem solve, because it goes from understanding, well, okay, I need screening, well, great, to like, well, how do I get that done? The other thing I'll add is for people who need a little bit more help, we put our phone number, the American Cancer Society's 1-800 number, it's 1-800-227-2345, on the Crucial Catch branding, so that if people have questions like, well, will my insurance cover this? Or, how do I get a ride to that appointment? Or, am I really eligible because my family history is a little bit different? Am I at average risk, or should I do something differently? How do I bring that up with my doctor? Are all things that we answer on our 1-800 number, which, by the way, we staff 24/7. We get about 250,000 people who call us every year and ask questions just like that. We offer that up to everybody as a free service to say, let us help you problem solve so you get those cancer screenings done.
You said a number a little bit ago, 50% of men don't get tested for prostate cancer via PSA test or that type of thing, or screened along the line.
Right.
Part of the mission, I know, of the NFL is to make sure that happens. And sometimes it's not so much the doctor as it is the patient that has to say, I want to be screened for this, to make sure that they get that screen. That also means maybe a blood test for other things as well. But the patient, you have to take that responsibility on your own to go get tested.
You do. And I think that, the good news here is that, for some people where the thought of testing might be scary or urgent, it's not. And I think it's important to juxtapose it against, for example, to the COVID vaccination, where, this idea of a preventative health measure, has had a lot of mixed feelings, though I'm a physician, so I clearly advocate everyone to get vaccinated for COVID. But I think that that's the backdrop, and we have to acknowledge that. So here's the issue. One is these cancer screening tests have been around for decades, and so they're absolutely safe. They have, proper procedures in place where we, call people back if we have to do the test again, et cetera. But the other thing is that sometimes they're anxiety provoking, because it can be easier a bit to sort of say, well, look, I've got a busy life. I got a lot going on. Let me just not think about this because it's scary to think about. And, the challenge, I would say, is that we can make cancer screening much more sort of palatable, right? And so, for example, our campaign this month from the American Cancer Society is called Grab Your Girls. Ideas for women who are eligible for screening mammograms is to make it a social event, get together, help each other, cheerlead each other, because those anxieties are real. But when you're doing it together, it'd be great where everyone goes and gets it done, and then you go have dinner that night and drinks and sort of, kind of talk about other things. And I think for men, the same idea. Oftentimes it's like, well, I don't want to find scary information. But generally, right, we don't find anything that's something that needs to be done. What it is actually more an opportunity to have reassurance, and then to move on with your life and not have to think about a cancer risk because you've sort of checked that box and moved on.
So if you're a spouse, if you're a caregiver, if you're a parent, encourage your dad, your mom, your friend to get tested for cancer. And the Crucial Catch website is just perfect as a way to find the best way to do that.
It absolutely is. And on that website, we've got sort of what's called the NFL Defender tool. That idea is you put in your information about sort of, kind of who you are, your age, your gender, et cetera. And it will show you what are the recommended screenings for who you are, right? And then you can put in your zip code and figure out where to go. And then if you still need more help, you can call us at the American Cancer Society, and we'll help you navigate the website, the phone number, insurance and other issues. What we're trying to do is take all those barriers away from people, because there are real barriers, right, that happen in terms of scheduling and things like that. But look, our goal is to continue to reduce the number of people who are dying from cancer, all kinds of cancer. And we've made a lot of progress in the last 20 years. There is a concern that some of that progress, though, will get reversed because of millions of people missing cancer screening during the pandemic. We don't want that to reverse. In fact, the goal is for another 25% reduction in the number of people who die from cancer over the next 20 years. I mean, that's the goal that was set forward by, for example, the White House, and the Moonshot Initiative is calling that out. But the best way to get there is people to get their cancer screening done, for them to have conversations with their doctors, and importantly, to remember to know their family history. And the reason I say that is because oftentimes in my clinical practice, I'll ask them and they'll say, well, grandma had a cancer, but I don't remember what kind. And Uncle Bert had a cancer and I don't remember what kind. It's really important, particularly as the holidays are coming, to have that conversation with your family and, kind of push on that information, try to get to specifics. The reason why specifics are important is because they help your clinical team understand if your risk is higher than average or lower than average, and whether a screening test might actually need to be started earlier in life. So, for example, a person whose great uncle Bert had stomach cancer and great aunt Martha had ovarian cancer, they themselves might be at higher risk for breast cancer, even though breast cancer was not a named cancer that was coming up in the family. But some of these cancers sort of run together. And so if that person, after talking to their clinician, they might actually start doing mammograms at an earlier age, maybe at 30 or 35 instead of 40. But all of that is based on understanding very specifically what's been going on in the family.
I just love your passion for trying to help people with the whole cancer thing, and having been a part of the Crucial Catch program in Kansas City. The doctors there are just amazing, and how they deal and care for the patients. I want to find out where your passion comes from on this, and I think I know the story, but we're going to take a quick break. Come back and talk with our guest, Dr. Arif Kamal, who's head of the Chief Patient Officer for the American Cancer Society. Back after this.
The most successful investors are those that can keep their emotions in check and take a longer-term view at what portfolios will be worth 3 to 5 years down the road. I'd say that's the most important in determining what investor outcomes are. Market corrections will continue in the future. We've seen many of them over the years, only to see equity prices rise higher, and that'll be the case in the future.
Worth Wealth Management, enhancing lives and strengthening families.
Welcome back to Forward Ever with our guest, Dr. Arif Kamal, and he is with the American Cancer Society as their Chief Patient Officer. And Doc, you have some passion for solving the cancer problem, much like many other doctors do. I just love it. Where does your passion come from?
Well, I appreciate you saying that. I'm a Midwestern kid, so though I'm here in North Carolina, I grew up in Warrensburg, Missouri. I trained in Kansas City, and importantly, the most formative thing I did in my life really was taking care of my mom, who had advanced breast cancer. She stayed at the Hope Lodge in Kansas City. She got treated at KU. I mean, that was our local community and our support system. And I still consider myself a Kansas City guy, a huge Chiefs fan, and that's really where I call home, even though I live a little bit to the east of that. But I think all of us are driven by a personal experience. I mean, it's hard to find anyone who doesn't know a person who's gone through a cancer journey, and for many people, that's them. And I think that, every American fits into a bucket of either being worried about the risk of cancer, going through a cancer journey, or being a survivor. There's really no other category that exists. And I think we have to harness that passion, not just mine, but everyone's passion around that, to sort of say, well, what's the best thing I can do today? And the best thing you can do today is to go get screened. We're 5 different cancers that we can sort of eliminate the risk of if we just go and know what's going on in our own bodies, and then can move forward. And, we have seen real drops in people dying of lung cancer, people dying of breast cancer, people dying of colon cancer. And that's because we have screening tests in those areas. And we have to help each other out, right? Life is complex. There's a lot going on right now just in the world. And I think it's important to pick up the phone or text or, reach out to someone who right? Maybe just struggling a little bit, and sort of say, hey, there's a lot of ways to kind of get back into the mix. And one of them has to be getting your health in order. And one of those important areas is really about cancer screening.
And the longer you wait, it just doesn't get better if you wait longer.
It really doesn't. I will tell you, as a medical oncologist, I see patients all the time who, they're very upset, and appropriately so, because they have an advanced stage of cancer and they're just, doc, like, what did I do wrong? And at that moment, it's not it's not the time to focus on anything being different, because things are not different. But we all understand we wish them to be. And when I talk to those women, particularly as a breast cancer doc, what they tell me is, well, I'm going to tell everybody I know, so that frankly, less people have to go through that experience, right? And so I think the idea that we sort of out there evangelizing, right? This idea that there is a way to prevent from dying from cancer, several different cancers. And that's about, taking half a day off and go getting a test done. And, with frankly, a 90% chance nothing's going to show up on that test, you move on your normal day. It's just a really great thing. And I can't tell you how many patients have said to me, Doc, whatever happens, I'm going to tell everybody I know, go get screened. And that's why I'm here, is to really say, let's not wait for a bad story to motivate change in what we're doing. Let's look at this from a positive light, which is there's so much improvement in mortality we've made and so much room still to grow. And the best way to do that is just make sure we understand our own risk and get screened.
Doc, thanks for your work. Thanks for working with the Crucial Catch program. I think the NFL's raised like $23 million to help with this process. You've been a part of that. The American Cancer Society has a phone number. Give us that phone number again.
1-800-227-2345. And let me just say, from the dollars that were raised, right, that people, they come through, purchases of the Crucial Catch paraphernalia and the jerseys and things like that, is we get that money exclusively from the NFL and turn it around to fund quality improvement projects across multiple health systems in the country to improve access to cancer screening. I mean, that's what we're doing, is we're giving it to health systems who are offsetting, for example, the costs if people can't pay, who are, developing mammography vans and buses to go out into the community so that people don't have to come to the health centers. And there are health systems in the Kansas City area and in Kansas that we are very proud to have funded from that work because of our relationship with the NFL and Kansas City Chiefs and KU Health and others. And so I think it's important for everyone to understand that the cause is national, but the impact has absolutely been local in lots of different markets that your listeners are in. And we will continue to do that in thinking about all the different pockets of the country where there are particular challenges that can be solved by giving people resources to solve them.
Doc, keep up the good work, and look forward to maybe seeing you on the screen on one of the Intercept Cancer or Crucial Catch programs somewhere. Keep up the good work.
Well, go Chiefs. All right.
Yeah, go That's Chiefs. Great. You're right. Our guest today on Forward Ever is Dr. Arif Kamal, and he does a great job as the Chief Patient Officer for the American Cancer Society. Thanks for joining us, Doc. Thanks for listening. I'm Gary Shorman.
Thanks for joining us for Forward Ever, Leading in Challenging Times, presented by Worth Wealth Management. Join us right here next week for another episode with host Gary Shorman. Until then, remember to move forward ever, backward never.